I've struggled with this my whole life. It just made me so insecure and life-changing. Thank you, Dr. Lebowitz.
How do I know if I've got gynecomastia? Because I get a lot of people who say, Doc, I'm from India, I'm from the United Kingdom, I'm from California, I'm from Florida. I think I have gynecomastia. I want to Skype or FaceTime with you, or I want to come into the office if you're from the New York area and get your opinion if I have gynecomastia. So gynecomastia is not a diagnosis at all. It's kind of how you feel about the size or shape of your chest, the shape of your muscles, the contour of your chest, how you look in a t-shirt. Do the nipples stick out like puffy nipples? Or do you have this fat going on here that you just don't like to wear light-colored, tight-fitting t-shirts? Also, in a pool or on the beach, do you like taking off your shirt? Are you embarrassed about what you've got? This is what gynecomastia is. It's kind of, I hate to say psychological thing, but it's real. But it is also psychological in that people might have minimal things but be tormented by it, but be absolutely tormented by it. Or they may be big 300-pound guys that are also tormented because they have man boobs or puffy nipples or gynecomastia. So it's not a diagnosis. It's how you feel about your body, how you feel about your chest. Two types of gynecomastia, gland only. And these are skinny guys. Maybe they're 19, 21, 25, even later in life, 31-year-olds that are fit. I mean, they're fit, they got muscles, they go to the gym, they eat clean, they work out, they exercise, they diet, they do everything right. No extra body fat, but they have just gland, like puffy nipples. When they wear a light-colored tight t-shirt, it shows through, and they just want the gland out. They do not need liposuction because they have no fat. And this is perfect. I make my smile incision where the water meets the beach and dissect out the gland. I've got tons of videos on that. I've got hundreds, thousands of videos on that. I do it to perfection. I make a sad chest into a happy chest, sad chest into a happy chest by using my quilting stitches to lift up the muscle into the skin so you get more definition up on top and less fullness down on the bottom. Give you that perfect hockey stick boomerang shape to the chest, and it is to perfection. I guarantee my results, never a recurrence, but everything is included. If you need a steroid shot for scar tissue, it's included. If you need revisional surgery, 6 months, 8 months, a year, 2 years, 5 years later, it's on me, free of charge. I even Skype or FaceTime. I send people the steroid shot, Kenalog 10, and through FaceTime or Skype, we give it, actually you give it in my guidance when I Skype or FaceTime with you. Usually that's done once a month, and the results are perfect. I'm always available by cell phone, email, or text. Second type of gynecomastia is fat and gland. Some people call that pseudo gynecomastia. Pseudo means make-believe gynecomastia. And that's more fat. Those are guys that maybe they're a little older or they're younger, they're a little chubby, they weigh 190 pounds, 250 pounds, 300 pounds. They've got fat and they've got gland. Males always have gland, always. Even if you liposculpt, lipocontour, liposuction, the fat around, you need to get the gland out. Get rid of the tissue, get rid of the issue. So with pseudo gynecomastia, or people who are heavier, have just more fat, I do my Vaser high definition Power X liposculpture with my curved cannulas, my baby cannulas, my graded cannulas to give you perfect results. And again, guaranteed results forever. So gynecomastia is really how you feel about the size or shape of your chest. Is it just little puffy nipples, or are you just big with just not a good definition to your chest? Can you take off your shirt and feel great about yourself and feel masculine and comfortable and cocky? Let's use that word cocky. Self-confidence and self-esteem. I'm going to say it again. Self-confidence and self-esteem, very important. Let's talk about lab testing. Do not go through lab testing. Don't get an ultrasound It's a benign condition. It's not covered by insurance. It's benign. It's not covered by insurance. And by the way, I do not accept payment plans. I do great work. I do extraordinary work. I guarantee my work, but there's a fee to it, and everything's paid up in front before the surgery is done. But do not get an ultrasound. Do not get your testosterone, your estrogen, your prolactin levels tested. Maybe get your thyroid. If you're overweight, get your thyroid tested. Maybe you're hypothyroid and need a little synthroid to boost your metabolism. But if you diet, exercise, eat clean, care about yourself, you will be phenomenal. And every surgery that I do on people, be it gland removal or high definition Power X liposculpture with gland removal, I insist that everybody diet, exercise, loses weight, and work out to maintain the high definition results. If you need information about gynecomastia, either gland removal, high definition Power X liposculpture, call me, Dr. Lebowitz, Long Island, New York, 631-424-0101, 631-424-0101, your gynecomastia expert. Thank you and see you soon.